Okay, now we're going to insert the different catheter, the BD Autoguard. Some people call this the push button catheter. The safety feature is activated with a push button versus sliding the cannula off of the needle. And there's the button. So in this case, the inserter is in cleaning the area prior to adding the tourniquet. That's because the subject has nice full veins, so she wants to ensure that she doesn't fill them up too much. And I'll mention that she's already cleaned her hands, cleaned her work surface, and donned clean gloves. So now she's inserting the cannula bevel up while stabilizing the vein with her non-dominant hand. She's advancing the cannula over the needle, releasing the tourniquet. And that click was the safety feature. So she's removed the needle, already encompassed in the safety feature, no needle stick injury potential. With this catheter, the vein needs to be stabilized to prevent a backflow of blood. She's added, with this catheter again, she's added some gauze in case it does spill a little bit of blood onto the skin. She's added her pre-primed IV extension tubing with the cap, our microclave cap at the end, and checking for patency. It's getting great blood return. Because this catheter does not have the internal valve to prevent the backflow of blood, you do sometimes get some blood that accumulates in the threading of the IV extension. If this patient could not anatomically have a stat lock securement device, you can use a single ply of gauze folded in half and tucked underneath of the hub to prevent pressure on the skin, and then add your dressing over top of that. However, in this case, we'll actually show you the stat lock as well.
Oh, I don't have one.
Sorry, we're just going to go get our stat lock. This highlights the importance of having all of your supplies ready to go. And here's the stat lock. Again, this stat lock works for both the VIA valve and the BD Autoguard. Simply clicks in place over top, and then you peel back the backing. Stat locks are removed with alcohol. It's more effective than other adhesive removers. Now place your sterile tegaderm over top of the securement device. Ensure that there's no non-sterile tape underneath. If you need non-sterile tape, you can add that over top of the sterile tegaderm.